Hi, my name is Sarah Cartwright, and I am here to present a clinical case presentation. So our patient is a 41-year-old female. She is 66 inches tall, 178 pounds, which is 81 kilograms. She has a BMI of 28.7, which classifies her as overweight, and she was referred to us for weight loss. She reports being a busy mom. She has no history of tobacco use. Overweight and obesity does run in her family, however. She states that her father and grandmother were obese. She has intact skin, reports no regular physical activity, although she was an athlete in high school, didn't have problems with weight back then, but as she had children, she put on weight and then wasn't able to successfully lose all of the weight from childbearing. And the patient also complains of fatigue. So her usual food intake is convenience foods. Her two children are teenagers, excuse me, and are rather picky. So she doesn't want to be making separate meals for everyone, so she tries to just make meals that the family can all eat, and she eats with the kids. She purchases and prepares meals for her household, and she also states that she consumes one daily multivitamin. Breakfast, she states, is usually skipped, although she will grab a latte or cappuccino when she's bringing the kids to school. Then has a mid-morning snack of a donut and some milk. Lunch is a PB&J, a piece of fruit, and some soda. Snack when the kids get home of cookies and milk. And dinner is usually a burger or chicken with a potato dish, like a potato salad, scalloped potatoes, mashed potatoes, and then a starchy vegetable, either corn or peas. They'll do salad with ranch dressing, and then dessert is usually ice cream, jello, or pudding. And then later on in the evening, the patient states snacking on chips and dip with some juice. These are her current lab values. The fasting blood glucose reads at 126, which is an indicator for type 2 diabetes. Triglycerides are elevated. HDL is low. LDL is elevated. Her blood pressure is 140/90, and her waist circumference is 38 inches. Which does place her at high risk for cardiovascular disease, dyslipidemia, hypertension, and other related comorbidities. The primary nutrition diagnosis is undesirable food choices, as witnessed by that 24-hour food recall. Etiology is the perception that her lack of time, being a busy mom, prevents the selection of food choices consistent with dietary recommendations. And these are evidenced by the report of an estimated intake inconsistent with the DRIs, the elevated LDL, the elevated triglycerides, and the fasting blood glucose that is elevated. So her needs are estimated to be about 1,200 kcals per day, and this is based on the Nutrition Care Manual's recommendation of 20 kcals per kilogram for chronic dieters and those who are inactive, both of which this patient states are true. She also requires a coordination of care. She will be referred to a CDE or an endocrinologist for blood glucose monitor instruction. Nutrition education will include teaching the patient about carbohydrates and their impact on blood sugar, providing the patient with a sample food log to begin keeping a record of foods which impact her blood glucose the most. And we will be recommending a more balanced eating pattern, which follows my plate. Some examples would include having breakfast on a regular basis that consists of items like whole grain toast, an omelet with vegetables, small glass of juice, adjusting her snacks from high sugary items to more protein and fruits or vegetables, so a handful of nuts or a piece of string cheese, some fruit, are more appropriate snack choices for this patient. We want to be encouraging lunch and dinner choices that include lean protein, vegetables, a whole grain, and then limiting her dessert portions to no more than half a cup of ice cream or pudding if that's what she's going for. And then the monitoring and evaluation plan, we want to see that decreased fasting blood glucose down to 110 by 6 months. We would like to have a record of her eating breakfast at least 3 times a week by her 3-month follow-up. We would like to see the patient increase physical activity to at least 30 minutes a day, at least 3 times a week. And then also some gradual weight loss, so 5 months by the follow-up period. The references used include primarily the Nutrition Care Manual, but other useful resources when educating patients about diabetes are the American Diabetes Association, American Heart Association, and My Plate. Thank you.